What's up, everyone? Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. Guess what? This week, you guys are going to be hanging out with me as a chief resident in orthopedic surgery. I'm going to go over what's it like to be a resident, the downsides, the positive, the pros, the cons, everything else about residency. So you're going to see what I do in a particular week and a little bit about orthopedic surgery, why I went into it. For those who don't know me, I'm Dr. Webb, chief resident orthopedic surgery out in San Antonio, Texas. Next year I'm going to do a spine fellowship. So my last year residency, most people do a fellowship, the orthopedic surgery fellowship, after their residency. So 4 years of med school, 5 years of residency, and then a 1 to 2 year fellowship. So almost at the end, can't wait. I'm looking forward to finishing up this last year and then going off on my own. Check out my other video about spine surgery fellowship and my interview process. So if you're going on interviews soon, definitely check out this video right here, because I give a lot of tips about just the interview process itself. I even gave a lot of questions about what they asked me on the interview trail, specific questions. They asked me this is what my response was, and some other tips about travel, ways to save money, so definitely check it out. But right now, I'm on a rotation. We do hip and knee replacements, and also some other general orthopedic kind of trauma cases like ankle fractures and hip fractures. But mostly, I'm learning how to, which is the bread and butter of orthopedic surgery. If you're an orthopedic surgeon, this is your bread and butter, doing hip and knee replacements. So I work with a couple different surgeons. We operate a couple days a week, and also I spend some days in clinic as well. Today we have 2 knee replacements. Basically, there's a staff surgeon who's in the room who kind of manages everything and makes sure everything kind of runs smoothly, and also does our teaching. He's our professor. And then chief resident, and then I have a resident, a second year, who will be in the case as well. So the way it usually goes is the staff usually kind of walks the residents through the case, and they say, hey, this is how I would do this knee replacement, because everybody can do it a little bit different. This is the anatomy here, this is the approach, this is what you should look out for. And the majority of the time, it's either the chief resident doing the case, most of the case, and versus the junior resident, or the chief resident walking the junior resident through the case. So it's a learning process, and you do a lot of these in your residency. So you tend to get very good at them for a general kind of knee arthritis. The more complex ones are a little bit different, but for the most part, most people who come out of a residency get very good training in how to do kind of the bread and butter orthopedic cases like ankle fractures, hip fractures, knee replacements, knee scopes for like a meniscal tear or ACL tear, those things. So you guys are going to hang out with me this week. I look forward to it. Email me, overcomingtheoddsbook@gmail.com, with any questions, and also don't forget to subscribe. So I just got to the clinic basically to go over some cases for the week. We meet with our staff surgeon and also the residents on this service to essentially go over the cases that we have. This is what we should look out for. We go over some educational things, some teaching points. So meeting with the resident on my service and also the staff surgeon. So there we go. All right, so I'm here in clinic. Like I said, I'm on the joints rotation, so we do hip and knee replacements, and this is just a model here of a knee implant. And what we do, this is the femur up here, this is the tibia. So this is the prosthesis that we use is a metal implant. We cut the bone to basically shape this implant right here. So cut the femur in different sections or different parts. You can see from the side there. And then this knee implant right here goes here. So if they have arthritis of this bone, this implant kind of goes right over that bone. So you don't have bone on bone anymore. You have this metal with this plastic right here. So this is the tibia component right here. We cut the tibia so it accepts this portion of the implant. So this is be the metal portion here, and then the plastic portion here. So the metal portion goes right in here in the tibia and the plastic. And so you don't have bone on bone anymore. You have this metal on the femur here. I'll put this implant on. And then you have the plastic, so this is a total knee replacement. So we replace the parts of the knee that are diseased. And it's a very common procedure in orthopedics. It's one of the most common procedures that we actually do as a knee replacement. So the patient has a new knee, they're able to walk, place weight on it, and not have much pain from the bone on bone from the arthritis per se. But this is kind of it's a really cool procedure. Surgery takes about an hour and a half, and patients usually go home the next day or 2 days, and they're kind of back doing some of the same things that they were doing before surgery. So I just got done studying, about to go check my mailbox, looking at some people here who are really big names in orthopedics. These pictures are on our wall here when we first come into the orthopedic office. So I just saw that I have a white coat here. We have a laundry system that drop off our white coats, and then they do clean them for us and turn them back in for us. But let's see what I got. All right, there's mine here. Essentially a journal article for orthopedics, and this is just a meter that lets us, or it keeps everyone in the loop about how much radiation you're exposed to. So this little meter here picks up how much radiation that you get, and if you get too much radiation, people get notified. So this basically, we wear this on our badge or kind of close to your chest area, and it kind of monitors how much radiation that you get. So it's about 5:30 a.m. One of the rotations that we do is, or some of the rotations is with private physicians. So these are surgeons who are in private practice. Gives us a good perspective of life outside of like academic medicine. So check out my other video about academic versus private practice and what happens after residency. But today I'm downtown at a hospital with some private physicians, and I'll be here doing hip and knee replacements today. So I'll be here till maybe 12 or 1 o'clock this afternoon, and then I head to clinic. Just got out of the operating room. This hospital that I'm working at now, with this rotation, we have valet service. So I'm out here getting my car valeted. Actually about to pick it up and then head to clinic. This evening we have lecture that starts around 4 to 6 o'clock. So just got in my car, leaving the operating room. It's pretty cool to leave the hospital and jump in your car that's valeted for you. About to head to clinic now. That's a couple hours where we see patients that are coming from surgery or already had surgery or going to have surgery in the future, or just new patients. And clinic lasts a couple hours, and then I'm heading to lecture, like I said, this evening around 4 p.m.
And there's a deletion of chromosome 13. Not always, but it's wonderful. So remember, round cell deletion. Another example of a deletion is
So I'm just getting to the hospital. We have a surgery scheduled at 12:30 today. It's about 12:15. The surgery is going to start here in the next 20 minutes or so. I just left clinic. So being a surgeon entails seeing patients in clinic, which can be very busy. I think this morning we saw maybe 35, 40 patients, and then we schedule surgeries in the afternoon. So it's a combination of running to clinic, seeing patients, and also going to surgery. And then tomorrow, similar thing. We have surgeries in the morning at one hospital, and then we go to another hospital for more surgery. So busy day today, but I'm about to head into the operating room here shortly. So I'll check in with you after surgery. What's up, guys? I just left the operating room. I'm about to head home to do some studying, and after studying I will probably hit the gym up. I just got home from work and I'm about to do some studying. If you haven't already, check out my video about board preparation. In orthopedic surgery residency, after your 5th year, you take your board exam to become board certified. So I have my board exam coming up in about 9 months, so I'm preparing for that every day. The way I'm preparing for that is I'm doing lots and lots of questions, and I think questions are key to being successful on any exam in your medical career. So every day, in addition to working 60 to 80 hours a week, I come home and I study by doing questions, and there's Q banks that help us prepare for questions in residency to take our exam. One of the additional resources that I'm using is called Lecturio, and this is a website that is taught by Ivy League professors from all over, from Harvard, from Yale, from Stanford. And these professors, they have lectures, they have Q banks for almost any exam that you're studying for along your medical path, including the MCAT, Step 1. They even have some stuff for nurses for the NCLEX. So this is the website here, lecturio.com. You go in and you log in with your login information. For me, I already logged in, so I clicked on login and it brings you upon your curriculum here. They have lectures for pretty much anything that you can think of. So all medical courses, you can change it to Step 1, Step 2, the COMLEX, NCLEX. So I clicked on all medical courses, and the section that I'm studying for my boards is about spinal cord. So I'm gonna go down to surgery here. They have physiology, pulmonology, radiology, statistics, surgery, vascular medicine. So I'm gonna click on surgery, and they have 99 videos about surgery from pretty much any topic that you can think of. So I'm gonna click on special surgery here, and I'm gonna go down until I get to the spinal cord. And it just happens that I'm reviewing this particular topic concept for my board preparation. My main go-to source was YouTube before this, but I usually use these videos to enforce it with some questions.
We can't talk about spinal cord syndromes unless we have a basic understanding of the important spinal columns. Here, I'll describe to you 3 very important spinal columns so that you can understand when one of them is injured, what the resulting pattern would be. Focus on the green areas for now. In the dorsal space, or the back of the spinal canal, is a dorsal column.
So after you review the video, there are some questions that you can you can answer. So which of the given tracts conveys pain and temperature sensation? Pretty straightforward question. This is the lateral spinothalamic tract. And that tells me that I'm correct. So I use this website here to kind of review concepts while I'm doing my studying. Like I said before this, I was using YouTube, and I would review a concept. If I was unfamiliar with a particular spinal cord syndrome or pathology, I would just look it up or Google Wikipedia. But actually having a professor from Harvard kind of teach you a lecture about that particular topic, I think is very essential, and I can't think of any other website out there that can offer this. So if you guys are interested in Lecturio to supplement your studying or additional Q banks or video lectures, I think it's a great resource. The link for the code is in the description. The code is DRWebb20 for 20% off of your subscription. So I just got to the hospital. It's about 5:30 a.m. I'm on call today, and I get off tomorrow afternoon sometime. So this is our call room here. Ortho chief call room. We have a computer on a desk file. And a pretty decent sized bed there. A phone here, just in case you needed to call back someone to page two, and a really nice bathroom with a shower. Really decent sized shower. So this is where I sleep and hang out at. If there's nothing going on, I get to lay down for a couple hours or even a couple minutes and rest my head. Some magazines, articles that we can read. But yeah, this is where kind of we hang out here in the chief room. All right, so I'm just now leaving work. It is about 1:30 p.m. I've been at work since yesterday around 5:30 a.m. I don't even know how many hours that is. I'm exhausted. I'm about to go home and crash, and then I'll get up and do some studying later. But last night was fairly busy. I did a surgery of a gentleman who ruptured his patellar tendon, so I repaired that. Another lady who was hit by a car and broke her leg. Her bone was sticking out of her skin, so I fixed her leg. Another gentleman who broke his hip, and some other little smaller cases, but it was fairly busy, but I was able to get a few hours of sleep, which really helped being at work this late. But I'd like to thank you guys for watching and following along this week. I had a lot of fun. I hope you enjoyed it. Thank you to the sponsors of this video, Lecturio. If you have not checked them out, I suggest that you do. They're a dope program. They have a lot of new stuff on the horizon, and they just came out with a program or a different feature. It's called the walkthrough, where basically if you have a Q bank, there's a professor or someone who goes through the questions with you at video format. Say for instance you do a question and you don't know why the correct answer is the correct answer or why the wrong answers are the wrong answers. Well, they have a video, very thorough video, where they're going through each answer stem, question stem. This is why this answer is correct. Here's an explanation. Here's a diagram. I thought that was really cool. They also have about 900 new questions for their step 2. They have COMLEX coming soon. They have Spanish subtitles, basically everything that you need. Any test that you're going to take in your medical kind of path to become a physician or a nurse, they have the tools to help you do that and be successful. So definitely check them out. The code for the 20% off of your subscription is DRWebb20, and links to all of this, and as well as to their website, their YouTube page, is going to be in the description. Thank you guys for watching, and we'll see you next time.
you.